So Jenny, I actually have a question for you, because you seem to be really quite resilient and able to overcome a lot of this disease, burden here. So what would you sort of see as some of your best self-care strategies that you use to sort of, buffer yourself against some of these bad outcomes like depression or anxiety?
Well, thank you very much, Lori. That was very sweet of you to say. Um, well, one of the things that I do use is social support, talking to my parents, but also online support groups. I found it's helpful to be able to talk to people who know exactly what I'm going through and also share strategies back and forth, or even just to be able to talk it out. Sometimes, if I'm feeling really down, it's helpful to just let those emotions come and to have a good cry, and then I can move on. Some other strategies are exercise, which dealing with IBD, if you're really sick, that's the last thing you want to be doing. But even just trying to force myself to walk a little more, I think has really helped. And I can always tell it helps to stabilize my mood, make me feel positive if I'm feeling really fatigued at work. Just getting up out of my chair and going for a 15-minute walk can have a positive impact on my mental and physical health. I think seeking counseling is always a good option, just to have someone who doesn't know you very well to be a soundboard. Sometimes our parents and our friends are too invested in us, and their suggestions may not always be the best ones, or they may understand, but they want to help, they care too much. Um, so I think seeking that out is wonderful, and has helped me personally. One of the issues I deal with is, all of these things take a lot of time. We're, as IBD patients, we deal with a lot of fatigue, and getting through a day of work or school can be about all we can handle, let alone going to all these doctor's appointments. Um, some other things that I do meditate and have gotten into that. And I have also tried various medications. One of the things as an IBD patient that I always worry about are side effects, because I experience them with lots of medications. And I know that the side effects of a lot of antidepressants include fatigue. And that's one thing that, in speaking, not only I deal with, but in speaking with other IBD patients, that's one of our main concerns. How can we boost our energy levels? So that's always been a concern of mine. So, Laurie and Mike, what are some strategies in dealing with depression and anxiety that you suggest to your patients, in addition to, if you could talk more about medications and mental health services, but also, as Laurie mentioned, self-care techniques that we can do to boost our mood and keep us healthy?
Yeah, I'd like to actually really underscore that that social support component that Jenny's
Hmm.
talking about, because I think that really is the difference, that can buffer people from the negative effects of the disease and help them climb out of those depressive experiences. And I think when people are in transition settings, in your case, moving out by yourself, with your disease active, you were kind of vulnerable there because you didn't have that social support network. And sometimes, if you have a social support network already built in, that can really, it's just a matter of you reaching out and leaning in and telling people you're having a hard time. But other times it really does require seeking out help from colleagues or counselors or therapists or even psychiatrists to sort of make sure that you're still getting that support, even if you don't have close friends and family wherever you're located. Our goal is really to kind of get them back engaging with life. And, sometimes when you're depressed, it's really hard to think of things that you could do to take care of yourself. And having a therapist that can say, or a friend or family member who can say, I want you to make sure that every morning you put on makeup. every night before bed, you take a bath and light a candle. You do things that are just sort of not intuitive when you're depressed, but could potentially influence your mood and engage in some self-care. I also think that, you know, improving some of the things that impact coping, like sleep, for example. People get very depressed and down and are unable to talk themselves out of that when they haven't slept for 5 nights or they haven't slept soundly, or they're tired. You get overtired and it's just a lot harder to cope with things. So sometimes we really focus on normalizing sleeps, normalizing eating patterns, normalizing, people's schedules. There's some comfort in sort of having a nice schedule that you follow when you're depressed, so that you don't have to generate a lot of your own decisions and energy like that. I think that there's it's also really important when managing emotion more broadly to think about emotions as very temporary, right? And a lot of times we get ahead of ourselves. We assume when we're depressed that it's going to be like that forever. We assume that our disease is going to be like that forever. We assume that our lives are sort of stopped and we're stuck in this rut. And so that's where things like mindful practice and being able to really look at things as temporary, and sort of rein in some of that future worry and anxiety and rumination about, feeling sorry for yourself, basically, can really kind of help people get out of that rut a little bit. I think that sometimes people are so depleted from their health situation by the time they get to mental health care that, they're really bumping up. It's an uphill battle to be able to even engage in some of those other coping strategies. And I think that's where maybe Mike can talk a little bit about how he utilizes antidepressant medication or other things, where, the depletion reaches a point where we need to chemically, provide some support in order to kind of bring things back into a normal pattern.
Thanks, Lori. One of the things that I always try to do as a gastroenterologist is recognize depression or even depressive signs and symptoms before they become too much of a burden. And when I do recognize depression, I will often recommend a number of approaches, all at the same time. I'll typically recommend seeing a psychologist or a therapist, and particularly one that knows a lot about medical disease and inflammatory bowel disease in general, and sort of what patients go through and what coping strategies and skills typically sort of work in this setting. I do recommend sort of healthy living and particularly exercise, meditation or yoga if that feels right to a particular patient and at a particular sort of time or setting, and occasionally do prescribe antidepressants. As a pediatrician with black box warnings for antidepressants, it becomes a little bit of a tricky situation, and often I'll coordinate closely with a primary care physician to sort of co-manage that aspect of a patient while they're under the care of a therapist or psychologist as well.